Sorry, who will be presenting from group 1?
Yeah, I'll present, ma'am. Dr.
Okay.
Yeah. I couldn't send the, I'll just share the screen. So is it clear, the slides?
Yes.
Okay, should I put in the slideshow now?
That will be better.
Yeah. So today our topic was principles of pain management in terminally ill. So this is actually the competency AS 8.5. This is for the 4th year students. The duration we thought it will be 1.5 hours it's given. So the competency is describe the principles of pain management in the terminally ill. So the domain is knows how. And we thought we'll take in a large group discussion initially. And then we are going to divide them into small groups, which will be held in the palliative ward or in the general ward or in the ICU. So we thought integrated teaching at this stage between pharmacology and medicine department would be better. Along with if the colleges have a palliative person, it will be very nice to integrate with them. So these are,
please change the slide, madam.
sorry. This is a session details.
Yeah, it's not moving, Dr. Anupama. We are not yet seeing the slideshow mode.
They are not able to show. Okay.
No.
Yeah, now.
Now also the first slide is there, madam.
Now this is second.
Yes. Second.
Yes.
Okay, so shall I go on to the slideshow now again?
Yes, yes.
Now it is seen.
Yeah, yes, but only first slide, madam. Please project the third slide.
Madam, we are not seeing the slideshow mode.
Sorry for interrupting, ma'am. This happens many times with the
Slideshow.
issue of compatibility between the PPT and the Zoom mode. So you just can scroll.
Yeah.
Okay. Okay, fine.
Just use the up and down arrow buttons and they will be able to, even though not in slideshow mode.
This is okay then? Yeah. This is
Yeah.
okay?
Yeah, this is better, madam.
Okay, fine. Now the so we have done with the integrated teaching format, and in this session is topic principles of pain management in terminally ill. The outcome already we have mapped as AS 8.5 module, principles of pain management in terminally ill. What we wanted is session type is a didactic lecture we'll take with PowerPoints, and this will be for 15 minutes, wherein we have got a recap because these are 4th year students. We'll have a small group teaching 2 major groups, which will be subdivided into 3 groups each. And the session will last for 40 to 45 minutes. So this completed the 1 hour. And then we are going to have a summary at the end for 10 minutes, followed by assessment with checklist and MCQs for 10 minutes, and then the concluding remarks. So the total duration is around 1.5 hours. Session objectives are discuss the situations where the goals of the therapy is relevant and discuss a framework for pain management in terminally ill. So we thought teaching and learning methods, we can use didactic lecture with PPT as well as case-based teaching, which we can take them to the wards and also demonstrate the cases in the various scenarios. Assessment by active participation through checklist and MCQ, this again can be through the case-based scenario. So the large group discussion, as we thought, we'll start with integration with pharmacology and medicine, and case-based scenario discussion will revolve mostly around identification of terminally ill, goals of therapy and pain management. So since it is already 4th year students, so we thought already they are exposed to few topics in their 1st, 2nd and 3rd year in the various competencies when we discussed on empathy, physiology of pain, various dimensions, how do you assess pain and communication skills. So we'll just have a recap quickly to make them enter into this. And then we are going to highlight the principles of the pain management by highlighting on the WHO analytic ladder and how we have got a stepwise approach to treat the cancer pain. And assessment of pain also we are going to show wherein through the PPT itself, and we are going to make them think of it on the visual analog scale and the numerical rating scale. So similarly, WHO analytic ladder, again, we are going to highlight on this and how we give the principles of management regarding by the ladder, by the clock, individualized to the patient, using adjuvant drugs and attention to detail. So each one will be highlighted little bit regarding the NLC ladder, and then what are the advantages, how it's a validated tool and how it has been changed, and how it is well suited for home care, and both for acute and chronic pain you can use it. So this is a modified NLC ladder which we'll be highlighting on during the didactic lecture. Then we are going to actually, once we have had a brief recap, then we are going to have a case scenario. So this will make them involved into it, and we'll ask them actually to sit with a prescription, and maybe we can divide up, we can give them all a prescription pad which is empty, and we'll ask them to write their name and sign, and then go through the scenario, and we'll ask them to write the prescription. So that will make them involved rather than being a monotonous didactic lecture. So a 65-year-old female patient who was diagnosed to have invasive breast CA, grade 2 with extension in lymph nodes, liver and skeletal mets. She has completed 2 years of chemotherapy. Now she has got admitted with febrile neutropenia and sepsis, AKI, and is complaining of pain in the lower back, restlessness and breathlessness. So then discussion during that time, we can ask them to write a prescription on the pain management. So then we'll collect all the prescriptions and we can actually evaluate it. And so they'll be also curious to know whether they were right or wrong, and what went right, what went wrong. Similarly, identifying of the terminal illness, whether they were able to do, and the goals of therapy and the pain management can be discussed in these times. Then we are going to make them split, as we thought, into 2 faculty only can be accommodated. It's very difficult to have for each group 1. So we'll divide them into 2 major groups, and those will be divided into 3 subgroups. And simultaneously, both faculty can take them for 40 to 45 minutes. The discussion will revolve around the patient whom they are actually seeing in reality, in the palliative ward or in a general ward with sick patients, or in an ICU, depending on the situation and the institutional resources. So after the discussion, the presentation will be done in a separate room so that the patient's privacy will not be affected. Then we'll have a case-based discussion. Again, it will revolve around the individual patient, how we can manage pain better. And then finally, we are going to summarize it. Then we thought we'll have an MCQ. Either this can also be case-based. And then we'll just have a checklist to see how active participation from all the participants. Thank you, ma'am. I'll just stop my share.
Thank you, Dr. Anupama. I would like to hear from the faculty members. Or participants from other groups also.
Ma'am, I'm just curious to know how many sessions are you going to divide this class into, and how are you going to allot time for the bedside cases?
Ma'am, we are going to have a 15 minutes didactic lecture. That's all.
Okay.
Not more than that. Yeah. In 15 minutes, we are going to just quickly recap and put that case-based discussion. And then we are going to split them into 2 major groups. And the faculty, 1 faculty will be responsible for each group.
Okay.
They'll be given 45 minutes each.
Okay.
So then in that half an hour, the cases will be shown by the faculty. They will take them to 3 beds in the ward. So it's more of a ward round sort of, wherein we discuss in real patients. And then these group, one of the person will present in the larger group when all of them sit together.
Okay.
Within 45 minutes, this will get over.
Okay.
And then we are going to summarize based on their discussion.
Okay.
Yeah. And there will be 1 person who will do the assessment simultaneously.
So that part they have proposed as flexible. So in case if they don't have access to patients, that part can be based on the paper-based scenarios also.
Yeah, paper-based scenarios.
My small request, Anupama ma'am, that
Yes.
it will be good that it is, if it is pain management in the end of life, we talk about continuous subcutaneous infusion, or we talk about fentanyl patches if they are not able to, take morphine tablets orally, and something about rectal morphine. If oral route is, they are not able to take, we must specifically pain management in, end of life care. We must talk about these routes also, and about palliative sedation. If if the distress and pain management is not adequate, we can just.
Okay.
Ma'am, you are muted, Lulu ma'am.
I personally, what I feel is that these are just fourth year students and you should not bombard them with so many ideas. What is required is just tell them that even at terminally ill phase, a patient has pain and that should be managed well. That should be the message. And they are not, they are just fourth year students. They become final year, then house surgeons, then whatever PG, and only after years later only they might become palliative care physicians. So now just keep it very simple. And the one simple message is that there is pain, though they appear to be sleeping and drowsy, there is pain. And unless pain is managed, that person cannot have a dignified death. That is my point.
Thank you, ma'am. Dr. Sunil, anything from your side?
No, the one point which I wanted to make, Lulu ma'am already told, the concept that even in dying patients, there would be pain. So there would be always doubt whether we need to continue the pain medication when the patient is dying. So if we do not provide pain medication, what would be the manifestation of the patient? What are the symptoms like delirium or patient would be restless? So all those things are something which we should be noticing. And when somebody feels that, okay, this much analgesics or opiates are not needed, then maybe it can be reduced to 2/3, but it should be continued. The analgesics should be continued. That should be the message.
Thank you so much, sir. So yeah, there is one point Dr. Dinesh is putting in the chat, like 1 or 2 takeaway points for each session, not more than that. I think that is applicable to everyone in the last few days. We have to keep it very simple. Over to group 2.
Shreedevi ma'am, can you please share the slides? The topic for today's discussion.
Just a moment.
Just give us a moment. I'll just, you can start talking. We'll just start.
The topic for our group was the common issues encountered in patients at the end of the life and the principles of management. This has been mentioned in the EdCom module 4.8, dealing with death. Competencies addressed are that the student should be able to identify the conflicts of interest in patient care and professional relationships and describe the correct response to these conflicts, and to demonstrate the empathy to patients and family with a terminal illness in a simulated environment. The level is they should be able to show how it is done. Next. This comes under the core competencies, that is the communicating diagnostic and therapeutic options to the patients and family in a simulated environment, and communicate care options to the patient and family with a terminal illness in a simulated environment. The module objectives are to explain the principles of goals of care discussion at the end of life, and to discuss the importance and methods of prognostication at the end of life. The module has been planned into 2 sessions with 1 hour each. This has been adapted from the end of life care module shared with us. The session's objectives are to discuss the situations where goals of care discussion are relevant, We'll discuss a framework of goals of care discussion and comprehensive care planning, and to explain how goals of care discussion facilitate shared decision-making and access to the end-of-life care. So, next slide, please. So before the lecture, the idea is to start with the recollection by discussing the all previous topics already taught to them, which are communication, breaking bad news, regarding empathy, or regarding the pain management. It will be an MCQ based test followed by 2 small essays or short notes regarding their own experience, regarding whether they had any death in the family, who was the patient to them, what was their relation, and what are the issues that they felt arise. It can be physical, like the issues subdivided into physical issues, emotional issues, and psychosocial issues, economical issues, and how it impacted to them. And the second will be on brief on the COVID and death and their thought about it. The lecture will be of 1 hour. We will divide the group into 3 groups. It will be a didactic lecture. What we will be doing that we will be sharing their stories in the beginning of the presentation, the stories of students anonymously shared for 15 minutes, where after that we will give them 5 to 10 minutes discussion time among themselves, and they have to present their one representative and their own views regarding what all the stories they have seen and what were the issues and concerns they felt that could have been managed. This is followed by 35 minutes of a lecture regarding meaning of life of end of care, symptoms, issues encountered in patients, correlating with their own stories. This is primarily will be a video-based case scenario where the scenes will be running and behind the audio voice will be played that will be addressing their physical issues like dyspnea, restlessness, death rattle, and the socioeconomic and psychological issues. Along with that, we'll be in those video sessions also, we'll be addressing those issues as well. Next slide, please. This session, after this first lecture, there will be a graph and we will be providing them a self-learning module, which will be a video-based recorded lecture, specifically regarding the gold standard framework of prognostication assessment. Next slide. This is again adapted from the end-of-life care module. The session's objectives will be to discuss the importance of prognostication in decision-making and access to palliative and end-of-life care, and to discuss the available methods of prognostication in cancer and non-cancer setting. And the session again will be of 1 hour. Next slide, please. This session, I am primarily starting not with the PPTs and all. It will be just in the beginning of 40 minutes group discussion, where we'll be dividing three groups, giving them case scenario to first 3 groups and the second case scenario to the second group. And these have already been shared to us the stories, so I will not be discussing the story as well. Where the main points of discussion will be to check the awareness of the family about the patient's condition. We'll explore the concerns, convey the information that further interventions will be inappropriate, how they will explain to the family that how can they make the patient comfortable, and reaching the shared decision making. What we can do, we can start the role play during these 2 sessions, and they will come up, the students will come up in the first three groups each to address these issues. Next slide, please. The same goes for the next group as well. Next slide, please. At the last for 10 to 15 minutes will be the final questions and the queries. And post lecture again, there will be an MCQ assessment and case scenario based questions. Next slide, please. Since this is the skill assessment based also, so in the controlled environment, what we had thought that it will be integrated in their clinical postings, where at the beginning they will be asked to take a history, to take a patient with any end stage disease or a terminal stage cancer. And in that, we will be addressing and checking the communication skills, whether they were able to identify the symptom and addressing those issues. At the same time, we have been discussing in the room that we will be providing them with the checklists, where they will be giving these checklists and noting these checklists regarding patient pain, anxiety, nausea, constipation, and harm. That will be done 4 hourly, followed by how they will prognosticate the family, how they will sensitize the family regarding the concerns. The scoring will be as per the EdCom module. Next slide. This is the brief about what we'll be sharing with them. Next slide. This has already been adapted. Next slide. So the summary should be the primarily our focus and what we need to tell the students is the comfort of the patient comes the first thing. And they need to review the symptoms regularly and reassess the need of each medicine, what they will be doing in the clinical posting. There should be a balanced need versus wants using ethical guidelines. The ethical guideline topic has been given to the next group, so I didn't mention that in our presentation. And effective communication and addressing the gap and providing the BMA support. This should be the final takeaway home message for them. Last slide. And that's it.
Thank you, Group 2, and for presenting Dr. Parul. Any comments from the faculty members?
Dr. Parul, I think you can ask the students, two situations. One, where the goals of care match the end of life care. And another situation where the goals of care do not match the end of life care. And what will be the outcome? So if you ask two groups to present that, the importance of identifying the goal of care and the importance of matching it with end of life care can be very easily conveyed.
Thank you, ma'am.
Because when you use terms like goals of care, end of life care, terminal care, I mean the students are likely to become a little bit confused. What is this goal of care? Who sets this? And what is its importance? What is so if you just give them a situation like this, and then all the issues and all the problems will come out.
Yes, ma'am. Thank you.
Any other faculty members? Then we'll move on to Group 3.
Very good afternoon. I'll be presenting our module from Group 3. I'll be sharing the screen now. Just a second. The same issue, ma'am. I'm not able to get it in. Okay. So our topic is ethical and medico-legal issues in end-of-life care. The target audience will be 4th year MBBS students. And for planning of the sessions, 8Com module 4.8, as discussed before, has allotted 5 hours. So it is assumed for the subtopic of medico-legal issues, it may be given about 2 hours. So as Dr. Parul had already quoted the module, what we deal with may probably be the first competency, where the conflicts of interest in patient care have to be identified and correct response has to be delivered, which is a show-how level of domain. And also the subtopics included in our topic, which is the withdrawal of life support and DNR, is actually listed as a non-core competency under 8Com. So on session 1 or day 1, it has been, we have given a duration of 1 hour for this. And teaching methods can be didactic lecture, large group discussion. And the objectives here are that by the end of the session, the student should be able to enlist the core issues of values of medical ethics and to discuss the various ethical and legal issues in palliative care. Both come under the domain of no. So the lesson plan is briefly as follows. First 10 minutes brainstorm, 25 minutes deliver the lecture. And here, if as Dr. Sunil sir had suggested that if there is a forensic medicine lecturer also there, and he can contribute more on the laws governing these aspects, it could help in vertical integration as well. 10 minutes for question and answers, 10 minutes to study one particular case, and 5 minutes to summarize. In the brainstorming, they'll be asked about what they already know, if they have any experience among family or friends, revision of the previous knowledge that has been already taught, and any famous cases that they have come across in the news recently. The main lecture will be delivered via PPT to a large group. And the core values, that is autonomy, beneficence, non-maleficence, justice, dignity, truthfulness, all this will be told briefly. Then we move on to the main important aspects of ethical aspects. Under that, pain control, the NDPS Act that governs pain control, the issues related to accessibility of opioids, and also the question, sometimes the patient will be dosed, a cancer patient at the end stage will have to be given opioid dose in higher amounts. Could that hasten death? Although it may be a little higher level for them, but maybe all these topics have to be touched upon. Ethical aspects about communication, that what the language barrier can do, how to address collusion, etc. And legal issues like withdrawal of life support, the fear of prosecution, there being no legal acts or guidelines governing this. So the outcome of all these, that patient can be discharged against medical advice, there can be increased financial burden on the family, etc. All of which will come in the way of end of life care. So although euthanasia and withdrawal of life support is just a non-core topic, they have to just be briefly told about what it means and why it is controversial in India, and what are the laws that are number IPC 309 and 306, which actually comes under suicide and abetment of suicide. So then they'll be asked if they have any questions. And then a case study, I was suggesting that the case of Aruna Schonbach can be given as an example at the end for 10 minutes and discuss various points, like what is a vegetative state and what are the Supreme Court's guidelines on this. And what are, in fact, in 2003, Dr. Sunil was mentioning that it was given, latest guideline was given, and any mixed, and what responses was invoked in the nation because of this, etc. Last 5 minutes, it will be summarized, and that will end session 1. On session 2, it is mainly an interactive session. It is a 1 hour duration. And here the objective is to identify ethical and legal issues in end of life care, and it is a show how competency. Here again, there will be a brainstorming session for 5 minutes, a case scenario by dividing into 3 small groups, a discussion and presentation by one group representative. Each will present for 5 minutes, so that will amount to 15 minutes. Discussion and summarize, and if time permits, an assessment at the end by one of our group members had suggested to form a panel among the group members and ask questions amongst themselves, and we will be assessing their knowledge. Also, a post-test can be given in the form of Google Forms. So these are the examples of case scenarios that can be allotted to each group. So where a CKD patient has decided that he wants to die, so how we are going to go about with this case. Or another case scenario where a respiratory failure patient with in chronic lung disease needs mechanical ventilation or not. Or a case with CVA and loss of ability to swallow, so what should be done? These are the examples. So after they finish the case scenario, there'll be a presentation. They'll come and then in the last 10 minutes, a feedback will be given to the students about how they perform. We summarize and wrap up the session, ask questions, and also provide resources and materials for self-learning in the end, and share the PDF files to them.
Thank you, Dr. Harini. I think the panel discussion you mentioned was a good idea because the students will also feel engaged and they'll have to have some background reading to lead the panel discussion.
Yes.
And yeah, bringing in the real scenario, Aruna Shamba's case, maybe before the session, maybe probably they can just read and come and start with some trigger questions about what did they feel about the judgment. So to the faculty members, we were discussing in our groups also that should we actually talk about palliative sedation and euthanasia? If so, and how to handle that sensitively? Otherwise, what if it conveys a wrong message? That we were just discussing in our group. Just question.
Harini, it was good you starting with, a family, certain incidents in the family, which the students can relate. That will make it very clear. We can go on talking for 2 hours, but unless and until the candidate identifies the situation on their own, then, our job will become very, very easy. It may be simple. The doctor advised a right tube insertion, but my grandfather didn't allow, or grandmother didn't allow. And from there, you can just start, like that,
Yes.
So that is very good, starting from issues happening in the family.
My take is, I think this slightly content heavy sessions. For 2 hours, lots of things we are trying to push. Maybe you can have more in the handouts and assignments. And as ma'am told, more experience sharing and the critical cases which you have pointed out, that Supreme Court judgment, Aruna Shanbhag case, and those cases, there can be discussion on that.
Okay.
And the content part again has to be cut down, basically.
Okay.
That's my take.
I was wondering that maybe to cut down the content part, asking them to read after the session, you can give the content before the session starts and then ask them to come prepared. That way they will be more well read. To ask them to read the Aruna Shanbhag case, to ask them to read about what is passive euthanasia, what is withdrawal of life support, and withholding, what are the differences. So they will come prepared beforehand, and then your part will be easy.
Okay.
In the same line, what some other people have tried, I don't know how much feasible it is. Instead of giving everything, like they usually release material over 2-3 days.
Okay.
So it keeps them slightly, that curiosity factor is there. What is going to come next?
Okay.
Depending upon feasibility. Because some faculty for some sessions they have tried here, like, so you have plan in advance, then gradually over 2-3 days you can keep on releasing some material. So that will build up that curiosity factor also.
Okay.
There are no other comments. We'll go on to the next group. Group 4. I think Dr. Shravani's lost her network. Maybe someone else from group 4 can listen.
Then group 5, let them present and then group 4.
Yeah. They have a backup, sir. They have all the PPTs just in case Dr. Shravani was traveling. So Dr. Uma and Dr. Shanti is ready. So I think you have sent it to Sripriya, right?
Sripriya, ma'am, she has sent to you.
Yes, yes.
I think Shravani is the one actually prepared the final PPT. I'll try to put in. This is from group 4. The topic for us was therapies used in alleviating suffering in patients at the end of life. So the duration of class which is given in the module is 2 hours, and it's for the 4th year medical students. both the knowledge and ethics and communication, they should also know and they should also show how. That's what is given. Next slide, ma'am. So the learning objectives will be for them, or the end of life goals of care. What are the therapies for pain and suffering? And we have to involve the family and the caregiver, and at the same time give respect to whatever the patient wants exactly. And symptom management we have to cover up. The plan of care for a dignified, comfortable and peaceful end also we have to cover here. And the students, because they already know about palliative care in the medicine, they would have attended classes. So this topic will be taken up in 2 hour time, we felt. Next slide, please. So what are the topics we have to cover is identification of need for predominant palliative interventions. You know, these they have to, the students have at least know about all this. Unrelieving pain and restlessness, all this can happen. So students may have to be made aware of that. We have to treat everything and there are interventions available. Discussion of prognosis and goals of care with the family and the patient. Discussion of merits versus lack of benefit of various medical interventions. At the same time, we have to take care of the psychosocial and spiritual assessments and useful persons for the clinician table. So the student has to be at least aware of all this. So only then later when they, if at all they want to take up palliative care later or once they become physicians, they'll be able to address all this. Next slide. The preparation of students for the class one, actually we were thinking, because this topic, whatever said and done, cannot be covered in 2 hours, we felt. So we plan, we can distribute the PPT or a reading material 1 or 2 days prior to the class. So they know what they can sort of expect. They can prepare themselves and come. And first will be a PPT based lecture by teacher for 10 minutes. Now the teacher will be telling them about end of life and how do you identify this end of life, how to give end of life care. And next will be 10-minute video demonstrating the signs. And then we would also like to have, actually we'd like to have 2 videos, 5 minutes each of discussion of end of life prognosis and goals. That also we have to show them. We will summarize. Then following this, because we have already given them a reading material, and following this, the MCQ pattern of question paper will be given to them so that we could assess how they are able to take it up. And we thought something like a homework could be given. What are the interventions possible, whether it can be used, that they can write up and they can also write, next slide, reflective writing also they can do about if they have seen somebody in their family, whether they've had this end of life care and what was possible, what happened, like that they can write and come. Then the next day, students will be divided into groups, subgroups. This will not be a large group teaching. Here, 15 minutes to discuss different points like supportive treatment, care at home, caregiver being trained to treat symptoms, that sometimes how the patient themselves want to be in ICU or at home. So all this, and each group presents for 3 minutes, whatever they felt about that particular subject. And then there will be a lecture, or 10-minute lecture. This is by the teacher on mainly psychosocial and spiritual assessments. How the therapy will be based on all this also. And then the teacher summarizes 5 minutes on important take-home points. And the plan will be OSCE assessment, because the student has to be not only assessed for knowledge, they should also show how. So just to at least talk to the patient, talk to the caregiver, or how to talk about this total care. And so they can write the plan. Next slide, please. So the communication skill to show how the students again will be divided into 10 groups. Even students can be asked to probably, for the case scenario, we can ask them to probably prepare a checklist. Instead of the teacher preparing, maybe we can ask them to prepare the checklist. This is the scenario. What do you think there should be the things we should follow? And students can, 2 students in a group can be allowed to take the exam. The other students can see whether they're doing according to checklist, and then debriefing can be done for 10 minutes. Next slide. So at the end, again, probably we can show videos of patients who are on good end of life care. And sometimes we also have for our reading material also case scenario has been given, and video of a patient caregiver thanking the palliative care team, like how the patient had a very the proper good end of life care was there, and then how the patient was so dignified at the end. He was given a very comfortable, dignified death. So this will motivate. At the same time, students also will get to know that really how a palliative care and this end of life care is going to be useful. That's it, ma'am.
Thank you, Group 4. Any quick comments from others? If not, I'll quickly move to Dr. Dinesh, please.
Yeah. So one thing which we could emphasize is that all these things can be done in home care setting also.
Yes, sir.
Actually, they'll be thinking like end of care is all about hospital and slightly more complex things.
Yes.
So somewhere or maybe in most of the sessions, we emphasize that this can be done at home and even in relatively low resource setting like PHC and those kind of things. So that
Yes,
we
and
just
also
emphasize.
yes, sir. Thank you, sir.
Yeah.
And on symptom management also. Actually, we didn't say much about
that is okay, madam. We understand you might not be able to cover.
Yes.
But like whatever we are doing, everything is possible in home care setting to a great extent. That
Sure.
message should go.
Yes.
Thank you. We'll quickly move to Group 5. Will be presenting from Group 5.
Dr. Punita, ma'am.
Yeah, please.
Okay, actually, I couldn't make a detailed presentation, but whatever we could compile.
We can't hear you, Dr. Punita. Can you keep your microphone?
Okay.
Yeah, now it is audible.
Okay, so I have made a brief presentation only with some basic inputs from our group. And we had a discussion, but unfortunately, I couldn't share the screen in our room, also breakout room. So basically, our topic given was like grief and bereavement. The challenges in this concept is it is basically grief is an emotion which we have to explain to the students the basic concept and then see their understanding and evaluate and assess on it. So the concept is abstract and psychosocial, and not everyone will have had big bereavement experiences. Grief definitely people would have undergone. And already background is in third year they have been introduced to end of life aspects as discussed by the previous speakers. So the domain is communication domain. This is from the same 8 module, whatever the previous speakers have told. And the competency is show how. That is what is given in the 8 module. The target audience are year 4 students who are already have been exposed to the basics of communication and the end of life care concepts and the ethical aspects of it. The time given in this 8 module is 5 hours.
Dr. Punita, in between your voice is dropping, so it is not, we can't hear you continuously. Any problem with the earphone mouthpiece? Drop in between, it's not continuous.
Okay. Now, is it audible now?
Yes, now it is audible.
So the time allotted for this session is 5, this concept is 5 hours. We have divided it into 5 modules, basically. We are not very sure whether it's feasible, but this is the proposal.
It seems like microphone is away from you.
Yeah,
in between it goes away from you.
Okay. I will try to keep it nearby, sir. So we will introduce this concept of grief and bereavement to a large group of audience with a didactic lecture. The opening session can be started with questions of personal experiences of grief. Everyone would have undergone some aspect of grief in their life. So we can ask the students' experience to elicit interest in it, in the topic. And with that experience and with their reflection, we can go into the core of the topic, tell about the stages of grief and how normal grief will be, how pathological grief will be, and these concepts can be showed in a didactic lecture. We can also play videos of grief, how people will act in grief. Such videos we can show. This can also.
We can't hear you, Dr. Punita. We lost your voice. Yeah, now it is audible.
Okay. So during the same session, we can give a recap of the communication whatever they have learned already. We can give a recap of the communication, the do's of don'ts of communication. We can show some few slides on it. What should be told, what should not be told, what is the importance of silence, what is the importance of active listening, all that can be shown in slides. And then we can divide them into groups.
I'm sorry. So sorry, voice is completely breaking. We are not able to do the active listening now.
Anyone else from group 5 or just want to read and present?
Yeah, I believe that would be better.
Anyone else from group 5?
Actually, Sreedevi, they have not been able to do a group discussion in group 5. One of them busy in pathology, another went for some induction, and two others have not totally invisible. And there were only Vandana and Punita. And Punita, in fact, the father is admitted in the hospital. So because there was nobody else to take it up, she took it upon her, and she has done so much. So actually, we have not had a discussion at all. And she was not able to screen share also. So I couldn't understand what they are going to say, what they have discussed. And then only she told me that they have not had a proper discussion.
Okay.
But Punita is trying her best, yeah.
Ma'am, in a small group activity, what came to our mind was we can take them to ICU counseling rooms where patients, where there is people break bad newses and how the family or caregiver is seeing, taking the news, and the stages of grief we can show there. Patients can shadow the counseling room activities, and then they can write reflective notes on it. That can be done in batches, but I'm not sure how we can put it in, like if we divide 150 students into 5 batches, they have to come at different times only to the palliative care ward or to the ICU counseling rooms to see how bad news is broken or how grief, the cycle of grief can be seen. So the other concept what we had in mind was self-directed learning modules. We can upload some learning materials and videos regarding grief, the stages of grief, bereavement. Like in COVID, there were many deaths and many videos which will show grief and bereavement and the actions taken by various NGOs, or we can show some videos which will introduce the concept of bereavement care. And what kind of loss did that patient or the caregiver get? There can be physical loss, there can be psychological loss, or it can be a spiritual difficulty what they are facing. So to elicit that aspects, we can give them modules, self-directed learning modules, which the student themselves can see it and come back on the next day or to keep them engaged. Then another thing which we thought was on a panel discussion, but madam was telling it is not practical in today's scenario where hospitals don't have enough psychologist, enough social worker to sit in a panel and tell the students about it. So maybe to a large group of audience, what I feel is we can call for one lecture at least the psychologist and the social worker and sit in the panel, and all the whole class can be in the lecture hall, and we can facilitate a discussion of how bereavement support should be, how can we set up in our center, what is the positive effects of having grief and bereavement counseling, etc. Then the last one is like about assessment. Since this comes under most communication module, we wanted to assess it with the Kalamazoo scale
and do a role play or give a standardized patient who will act as if he is in grief, and the student should be actively listening, retrieving information them, okay, what happened, like that. Are they having eye contact, or they have speaking to the patient, the attender, in the right way? How is their mannerism, body language? Are they waiting, giving pauses? Are they being silent? All that we can notice and we can assess them. That is one thing for assessment we thought. And we can also ask them to do a reflective writing. That can be also an assessment mode. This much we could prepare, ma'am.
Thank you so much, Dr. Punita. I'm so sorry to hear that you're going through a tough time and there was not much help from most of the group members. I'm so sorry. But this is this you conveyed, you and your team member, whoever was there. I think it's Dr. Vandana. Thank you so much, both of you, just to put it together. Thank you so much.
Yeah, thank you, ma'am.
Sreedevi,
Yes.
Sreedevi, are you sure there are
Thank you,
5 hours allotted for grief and bereavement?
That's exactly where I was thinking when we were doing the workshop, we thought it is 1 hour.
Yeah.
That's what we have written in our presentation. We were finding it difficult to reduce it to 1 hour because it's a vast topic. So I'll just recheck. Dr. Dinesh, any idea whether it has 5 hours? I
don't
remember it as
recall.
1 hour when we
Yeah,
were creating the model.
1 hour should be adequate. 5 hours is too much. One. And second point, they're talking about taking it into small groups and into the ICU to show grief. Grief is not something that can be shown. It is something which is happening in the patient's mind. You cannot show grief to anybody. Okay. And again, when a small group is taken to the ICU, what does the rest of the batch do? But that's again a problem. And again, I believe, this more than communication, grief and bereavement is mainly a cognitive. You have to teach them what is grief, what is bereavement, and how to pick it up. And I mean, the last part only, helping the patients in grief and bereavement. And again, 4th year means morning will be clinical work. And afternoon, they come for this. And if you start with grief, the definition of grief, the definition of bereavement, they'll start to snore. So I think, the introduction is the most important thing. I was just thinking, recently, I'm sure you would all have seen a movie, Goodbye. Amitabh Bachchan, then Gupta, Neena Gupta, and Rashmika Mandana, where Amitabh Bachchan's wife dies. And the way he behaves, typical. If you just tell them, have you seen that movie? Go watch that movie. That's a good place to start off, how people will behave when they lose their loved ones. So I think, brief and bereavement is very difficult to introduce the topic, introduce it in a very interesting manner. Otherwise, it is a very, 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 very tight topic. And believe me, these topics are to be taught in the afternoons after they have had their lunch. So I think you have to address, when you take these lessons, you have to think about a very interesting opening. Okay, something like a century partnership. Only then we will be able to get across to the students, because basically I think it's mainly cognitive. You have to teach them what grief is, because even we did not learn anything about grief and bereavement in our undergraduate days. We have not. So this is a new topic. So, and you cannot show them grief. You have to only explain to them what grief is, and you can show them that textbook written by lady's name.
Kubler-Ross, no?
Grief.
Kubler-Ross.
Kubler-Ross, yeah. Kubler-Ross. And if you can, those who are interested can go and read that book. And things like that, Anyway, they had no time to prepare. That is the reason. And Punita has done her level best.
Yes, wonderful. And there is one of the communication modules, I think we've written a small activity which can be given to make them experience what they feel if they have to lose things in their life. So there is an activity mentioned in one of the modules. So I'll just find out in exactly which module we have written that. It's written step by step. I think it comes in the communication module. So that will be one thing that you can use. Thank you so much, all the faculty members. I'll quickly take a feedback. If you have time, we are happy to have you with us, all the faculty members, or if you're busy, I'm okay. If you want to leave and go back to your lecture time. I just wanted to see how this pattern works and whether there is any other way that we should go about next batch.
I think, Sreedevi, it is best that we move out for them to talk openly.
Yes.
Okay.
Okay,
Yeah.
ma'am. Okay,
Thank you very
so
much,
much, ma'am.
Sreedevi.
Thank you so much.
Yeah, thank you very much, Sri. Thank you very much, Valium. Thank you all candidates for spending time with us. I hope we have been able to help you, but I'm very doubtful about today's patterns because I myself don't know what they all have because I'm seeing this PPT for the first time. She could not screen share it also. So anyway, I enjoyed spending time with you. Thank you very much. I'm getting out. Thank you, Sreedevi.
Thank you. So I've seen Parul's feedback in the group. If anyone else have any other opinion regarding the materials that we share, anything else that you want, and if you have some idea about if you want a short lecture by someone on a particular topic, we can make the faculty do the video recording through the Zoom, which can be used. So all those things are possible. For example, Parul was mentioning about some short video somewhere. Then I was thinking we don't have a video in that particular topic, probably a short lecture. Like I've shared Dr. Rajgopal's few videos. So something like that, probably if you can. So yeah, recorded videos. And all of you have gone through the foundation course. So those recordings and the PPTs can be used also. Because that has been shared willingly by the faculty. Or if you need, like we get requests from the previous batches, can you share this particular PPT or can you share this particular recording? So we'll try our best to get those PPTs and recordings and share. So if there is anything else that, because we'll be continuing this program for n number of times. Our ambition is to cover all the 660 medical colleges. So if there is anything that you want to add or change, whether you are able to learn, and any feedback will be appreciated. If you don't have time now, we can take it in the WhatsApp group or you can send us personal messages. It will be very, very helpful because we are also evolving over each batch.
Ma'am, I have one question. If
Yes,
the
please.
platform modules gets modified in the near future, will their faculty development program we have to go for the refresh course or something like that?
I think even if it gets, it took decades to happen actually. So I don't think even if it get modified, I don't think the basic principles will be the same. The idea is to understand palliative care, understand teaching skills. That's also. This 5 days was specifically for the difficult topics like end of life care communication, where people actually struggle to teach the concepts. That's why we focused on only 3 particular topics because that's where people find it difficult. Even if they modify, I think they may modify the core competencies or some more topics or take out something, but the basic palliative care will be the same. The teaching methodologies will be the same.
Thank you.
Madam, I just wanted one thing.
Yes, ma'am.
Yeah, basically what is happening is most of the clinicians and who deal with it, they are always busy and they don't get any time and they are mostly busy either with ward, ICU, emergencies. And they are the ones actually who are mostly breaking the bad news or this pain management or empathy. And many a times preclinical people, anatomy, physiology, they take the classes. In most of the MEUs and MEUs, medical education unit, hardly there are 10% representations from the clinicians or from the other specialties. So what happens hands-on? Do you feel practically that is it going to matter really? I mean, because people who have hands-on experience day in and day out, maybe in a day we'll break 5 this one or we'll empathize all these. So is it really going to matter the experience or is it okay?
Sorry. So I think it matters because it's very different when you teach from the textbook and when you, especially these kind of topics, empathy and communication. So that is why that there is a wonderful vertical integration. You can always go and ask them, can I take one session on empathy? Or can I also be that's what clinicians have been doing in the last few batches, like people from anesthesia and community medicine. I mean, initially we were also clueless how to integrate. Now you are trained. What is the next step is what they asked. Over a period of time, we learned that you can just go and ask the departments. So basically the 8Com should be led, combined by the preclinical and clinical, but it always falls on the preclinical people. Clinical people don't show any interest is what many of the institutions have told us. So it is easy. You can just ask, can I take one session on empathy? Can I take one session on communication skills? There'll be, I mean, that integration is what the beauty of the CBME. So I think that's quite possible to ask for 1 hour session from them, or I can do the practical part. I can take the students and show something after the clinical, this thing is done. So we have been invited to the Government Medical College here for some of the sessions, because there is a provision to call adjunct faculty also in the CBME and in the HCOM. You can call people from outside as adjunct faculty. So we used to go here in our medical college to conduct a few difficult topics, how it is like to be a patient, how to talk to a caregiver. I think for the first year students, we recently did a program. So I think that's the area where we want you all to go and explore. And please give us feedback after you take 1 or 2 sessions. Once you start doing, then you may have a point to share with us. We can also learn, and because we are not doing it first hand. No. We are a step away from that. So it will be nice to hear back from you all once you start teaching and what was the experience, what need to be done more from our side. I've seen all the chats. I'll be reading it one by one after the session. We've saved all the chats so that I can also learn.
Madam, one question, madam.
Yes.
Now we have different years, first year, second year, student, third, fourth, like that. Can we have a chart like the first year? What are all the topics? Second year, what are
Yes, ma'am. We have shared that. We have shared that in the drive already. There is a chart in which first year, second year, third year, final year, everything, which all topics, how many hours we have shared that as a PDF.
Okay, in which heading, madam?
I don't remember the heading. I'll just check.
Themes and topics?
Themes and topics. Yes.
Oh,
Themes
okay,
and
ma'am.
topics.
Okay, thank you.
Thank you. Thank you so much, everyone. Please give us feedback if you have not given, just to there is anything more needed. Thank you so much for wonderful 5 days of learning. And yes, Dr. Uma will be conducting more and more batches, and just send interested people for the foundation course first so that they'll learn palliative care, and then as a second part for the faculty development program. Thank you so much, everyone.
Thank you, ma'am. Thank you.
Thank you, madam.
Thank you everyone
Thank
for joining.
Thank you,
Just
ma'am, for the
reminding that
publicity.
the journey of 1,000 miles begin with a single step. We urge you humbly to start the first step. Once you have completed this faculty development program, take the first step, and rest assured we'll be there with you to support you all through the way, so that whatever hindrance you are facing is solved in time. So thank you everyone. Happy teaching. And this is Sripriya signing off for the last time from the faculty development program with Dr. Sreedevi, Warrier, and Mr. Adam.
I
Stay
just
connected.
want to,
We'll get
sorry,
the
Sripriya.
certificates.
Dr. Arun was asking about the facilitation team during the first session. Dr. Arun, most of these members have already gone through their session once or twice, probably. So I'll share the recording of the facilitation team and the scope of their work. What do they do? And if you have any issues in opioid availability or starting a palliative care department, anyone in this group, if you are looking forward to start a palliative care department, our regional coordinators will be in touch with you. We'll be giving your contact info. They'll call you and ask what all you need in terms of documentation, convincing the authorities, or they will connect you to any NGOs working nearby already. There might be some leaders already working in your locality, or we have a lot of requests from many states. Is there any palliative care doctor nearby? So you can give your information through our telehealth, to our directory. So we will be transferring your contact details to our regional coordinators. They will be in touch with you individually and will ask whether you need something to start services in your place.
Madam, you will be giving the certificates?
Yes, definitely, yes. Thank you so much, everyone.
Thank you, ma'am.
Thank you, ma'am.